Good afternoon, everyone. Thank you for joining us. We're really excited about the session today. I want to do a brief intro to introduce you to Laura Kurowski. Laura is a healthcare strategist driving digital transformation for social impact. She has worked with and for leading public and private healthcare organizations in her career. Today, she leads Microsoft Philanthropy's work in rural health resiliency. Laura co-founded the Rural Health Community and advises HIMSS Oregon, the OHSU Bioinformatics Program, and digital health startups. She'll be presenting today on resources and information provided through Microsoft. If you have any questions at all, please do not hesitate to unmute your line or put something in the chat. I will try to stay on top of the chat. If you are watching this recording and you have any questions at all, please do not hesitate to reach out. And with that said, Laura, I will turn it over to you.
Excellent. Thank you, Laura. Good afternoon, everybody. As Laura said, I'm Laura Kurowski. I work for Microsoft Philanthropies, and my role is really unique in that I am responsible for I help start up and lead the work we're doing in what we call rural health resiliency. And really, at present, it has two major components. One is cybersecurity, and I'll talk about that. And supporting that is actually a really first-time offer from Microsoft for independent rural hospitals, which I'll talk about. And then the other part is around introducing what I call pragmatic artificial intelligence, and I'll talk some about that. And then I'll end with a couple pages of resources so that as I talk about all these programs, you can know where to access them on the web. So before we jump into actually the meat, I want to put into context Microsoft Philanthropies and the work we're doing here. So when I talk about, or when I think about Microsoft and Microsoft Philanthropies, the way I describe it is sitting right between sort of the corporate Microsoft that we all buy our software from and use their products, and the Bill Gates Foundation. Microsoft Philanthropies is part of the corporate side, but it's the philanthropic arm, and we work with over 400,000 nonprofits worldwide, everything from the United Nations to local food banks, and providing grants, subsidies, unique programs to support mission-based organizations, and certainly healthcare is one of those. And so within Microsoft's Philanthropies, we've had for many years a very deep commitment to rural America. And the rural health work that we're going to talk about today is sort of the most recent add to that commitment. For years, we've worked through our team called Airband to expand broadband into underserved areas and have, to date, helped extend that broadband to over 7 million Americans, which is critically important for so many reasons, from education to just life to healthcare. And then the other area where we've done a tremendous amount of work in the last, going on 10 years, is in jobs and training. And we have a couple of programs that have been really specifically focused on rural America. And TechSpark is one of those, doing a lot in terms of training and jobs, having brought about 4,000 jobs to various rural communities around the country. And then more recently with just the work we're doing in making sure that AI knowledge and skills are available to everybody. So that's part of the broader picture. Now, as I mentioned, the rural health work is newer for us. It started about a year ago, and it's really anchored in two areas. One is cybersecurity, and then the other piece is the AI. And we've actually launched a little lab, a learning lab, if you will, which we call RAIL, and I'll touch upon that. That's all for sort of context of Microsoft and the work we're doing. You know, the broader question is, why the focus here? Why cybersecurity? Well, as you probably painfully know, healthcare is filled with cyber risk, and there's no shortage of statistics. What we see is that it's always one of the top one or two, and sometimes, depending on the ranking, the third most impacted industry. But I think the things that I've highlighted in orange are the ones to really hone in on, right? That we're all at risk. Every one of us as individuals, every one of our hospitals. And unfortunately, smaller organizations and rural healthcare organizations are disproportionately at risk. That's due to oftentimes having older system without the most robust security, and just a lack of resources to manage this onslaught of threats and attacks that happen. The other part of this is so much of what we see in terms of cyber risk and cyber threat are simply due to human error. And that's not pointing fingers at anybody. That's just a reflection of how manipulative and I'll call smart the hackers are. And we'll talk about some of the ways that this happens. And then unfortunately, the costs of cyber attacks can be just devastating to smaller organizations and to people. And I'll talk a little bit about that. But the average cost of a cyber attack in the US is $10 million. And that's in healthcare. And that means everything from fixing your systems to retraining to all of the manual labor and all of the lawsuits that may follow. So anything we can do to help avoid those, I think, is critically important. So you ask yourself, what could possibly go wrong in the healthcare ecosystem? This is a slide shared with me by John Rigi. He's from the American Hospital Association. He's the national director of cybersecurity and risk, also a former FBI agent, and very attuned into what's happening in the larger ecosystem. But I love this slide because what it shows is all of the typical systems and points of data sharing within a healthcare organization. And you don't need to understand too much about IT, except for one, there's a lot of systems in a healthcare organization in a hospital, and there's a lot of connection points. And every time there's a connection point, it opens the doors for a potential cyber attack. And in case you're curious about the red circles there, the one towards the bottom on the right, that's an electronic health record, and that shows all the points of connectivity. And then interestingly enough, the bigger one on the left side is the diagnostic imaging sort of ecosystem. And you can see with PACS and DI and MRIs, there's so many points of possible risk. So that's just reflective of the complexity of healthcare today. Despite that diagram, cybersecurity is not an IT thing. It hits every one of us, and all of us are responsible. So I've got a couple of examples up here. This is a larger health system, but this was this first example was an employee clicked on an email attachment just innocuously, and it ended up affecting basically everybody in the organization, shutting down all of their devices, shutting down servers, and ultimately, because they had to shut down operations temporarily, a loss of $63 million. Now that's at the organizational level. I talked earlier about the $10 million, which is kind of the healthcare average. But there's another impact here, and that's what it means to you and me as victims of identity theft. Studies have shown that on average, it's about $13,500 for an individual to recover once their medical identity has been stolen. That's everything from getting your information corrected. If they've stolen your medical credentials, they can usually get to your financial credentials, which can lead to, credit card theft, identity theft, etc. So it's a tremendous burden financially and time and energy. And importantly, in some of the more recent rules or proposed rules around cyber, there's a growing awareness that senior management, it's not an IT thing, it's senior management's responsibility to invest in and to support the cyber endeavors of the organization. And I think that's critically important. And what I've seen in the last year or two is I've seen healthcare organization, hospital leaders step up to that challenge. And speaking of stepping up to the challenge, over a year ago, we started planning, and in June of 2024, we launched the program, what we call the Cybersecurity Program for Rural Hospitals. We did this in partnership with the American Hospital Association and the National Rural Health Association, and with support from the White House. The goal was really to have an all-out partnership and sort of unprecedented effort to help rural hospitals across the U.S. with their cyber needs. And our program has three pieces, and I'll talk a little bit about each of them here, but assessments, which are pro bono, Microsoft-funded cybersecurity assessments for any rural hospital to really understand kind of where they stand, where the hospital stands against best practices and healthcare sector performance goals. The second is cybersecurity training and resources to support end user awareness and also to provide some baseline certifications. And then third, trying to make Microsoft products more affordable and more accessible to all rural healthcare organizations. And so I'm going to talk a little bit more about that on a future slide here. But it's nonprofit pricing. There's a step up for enterprise software for larger organizations. And then the last bullet in the lower right-hand corner, we will be launching a 1-year extension of the Windows 10 extended security update. So you have another year, and that will be coming out this late summer. So I mentioned the assessment, and I just want to talk about what that entails. So we have two cybersecurity firms that we've vetted, and we are supporting their work in coming and working with all rural hospitals. And to date, we've done about 500 cybersecurity assessments. These firms are very good at this. They're also independent, so they're not coming at it with a Microsoft slant or any sort of software slant. What they do is they look at the current state of the organization, and then they develop a written narrative document on findings and recommendations, and then they include in that final report a sort of a roadmap, and you've got a visual here of one of just high-level findings, and importantly, the sequencing and the timing of those recommendations. These assessments take about 2 hours of the organization's time, and there's no cost, and it can be just a really valuable validation or jumpstart into cyber security risk planning and mitigation. The other two parts of the cyber program, I mentioned them, but the first one is really the skilling and the training that we're offering. One is for frontline staff. That's the doctors, the nurses, the administrators, the front desk, just really around cybersecurity hygiene. And we've had about 1,000 people download and take that already, that training. And then the other is what I would consider a baseline training for IT staff who are looking to broaden their skills and understanding of cybersecurity. And it covers things like the general threat landscape, cybersecurity terminology, sort of foundational skills in cybersecurity. Highly recommend those classes for IT folks looking to sort of deepen and get certification in cyber. All right, the last piece in terms of the Microsoft program is the nonprofit pricing for independent critical access hospitals and rural emergency hospitals. And that's shaded in the light blue here. You can see that we've discounted a broader range of commonly used Microsoft products. And the discount is somewhere between 60 to 75% off for these products ongoing, which is really a substantial savings. So I've done some of this just back of the napkin math on this, and it's somewhere between, depending on the size of the organization, $30,000 to $50,000 a year in savings for an independent CA or REH. I also always mention this because I used to work at an F2HC, is that outside of the rural program, but also sort of in Microsoft philanthropies, federally qualified healthcare centers and rural health clinics are also eligible for this nonprofit pricing. And I encourage, even if you don't work in an FQ or an RHC, if you know someone who does, make sure they're aware of this. There's a link at the back of this webinar, so you can register for the program, and then that gets you a link to register for the nonprofit pricing. All right, two other quick things. For CAS and REHs that are part of a health system or for larger organizations, we have a product which we call the E5 Security add-on. And what that does, it's for larger organizations, and it really brings an additional level of protection to the Microsoft E3 licenses. We're giving it organizations 250 of those licenses at no cost for 1 year. And then I mentioned the Windows 10 ESU that will be coming out later this year. And so that's sort of the overview of the program itself. But one of the things we learned is in the last year in talking to a lot of rural healthcare organizations is the need for just more training, more insights into cybersecurity. So we launched in March a once-a-month webinar on a variety of topics, and sometimes they're higher level, and sometimes they're about Microsoft products specifically, and I'll talk about that. And then sometimes we have rural hospital CIOs coming and just doing sort of guest sessions around, you can see right there in the middle, I like to call this what I learned from my first cybersecurity attack. And here, this will be a rural hospital CIO who comes in and talks through what they learned as they went through a massive attack last year on their environment. And the reason we have a couple of sessions in here around Microsoft products is because one of the things we heard in talking to rural healthcare organizations is that you guys have a tremendous palette of tools that we can use, but sometimes we don't understand, or I need a better understanding of what the security features are of, product X versus product Y. Or I want more of a hands-on workshop to really understand, and in this case, for example, what are best practices in using Microsoft Intune for endpoint management? So we're running these webinar events once a month. They're not intended to be salesy. They're really intended to be educational, informational, and an opportunity to ask some questions. So again, hopefully you will be able to join some of these at your convenience and find them of value. The other part around the work we're doing in rural health is really around AI. And we do this for a couple of reasons. One, AI has proven and can bring value, particularly I think in its early stages around automation of processes, particularly as it comes to revenue cycle and billing, and trying to do everything we can do to help rural hospitals be as efficient and do more with less, if you will. The other part of this is we just know that there's tremendous opportunity and growth in what we call generative AI or Gen AI. It continues to gain velocity in work and life. And this graph on the right, I think, is really telling. This is sort of the adoption of three key technologies over the first couple of years of their life. And the one in blue, the bottom blue line, is just the adoption of personal computers over time. The orange one is the internet. And the green one on that graph is generative AI. And what you see is that certainly the growth of the use of the internet was faster in its first year, but you can see in year 2, generative AI, the growth and interest is really taking off here. And I would project, if we took a look at this graph in years 3, that the green line would sort of overtake the internet just in adoption. But here's what I found really interesting in doing research around this is a couple of things. Heartland Forward, which is a rural communities think tank, did a study in Alabama, Indiana, Louisiana, North Dakota, kind of the heartbeat of rural America, and found that most individuals thought AI could be valuable in healthcare. And interestingly, most of them wanted training, AI training in the workplace, 64%. And so, as part of Microsoft's strong footprint and expertise in rural, we're trying to make tools and training available. And I found this statistics just last week that I thought was shocking. 66% of leaders today said they would not hire someone without AI skills. And I thought that was just a testament to how individuals and organizations are seeing or expect to see great value in AI. So I think it behooves all of us in healthcare, in any industry, to skill ourselves up, but also to stay open to what AI can potentially bring in terms of clinical and business support for organizations, for hospitals, for clinics. So I mentioned this earlier, but as part of our own sort of self-discovery around rural health and its use cases, we launched last spring something we call RAIL, the Rural Health AI Lab. And we've had two workshops, and the workshops usually take a few months. And what we do is we work with a handful of rural healthcare organizations from across the country with different EHRs and different types of organizations and different levels of technology adoption, et cetera, to identify use cases they want to tackle with AI and to then create really affordable, sort of easily deployable tools that meet their needs, that are in line with responsible AI requirements, and that are accessible to everyone. And so the first one I'll just mention that we created is something, the Denials Navigator. And this is a great example of where we pulled the group together and said, okay, what can we potentially use AI to be helpful for you, for your organizations? And universally, the hospital said, help us with our rev cycle. Anything you can do there. It's such a convoluted process, and it's the lifeblood of the organization. So we came up with this tool called the Denials Navigator that is simply a support tool for billing clerks to help them investigate and resolve. And we've got it built out for Medicare and Medicaid insurance claims at this time, but it could be expanded. And what it does is it basically ingests insurance 835 documentation, the Medicare and Medicaid publicly available payment guidebooks, and anything you have in your own organization around notes on how you manage denied claims. The content and the tool sits inside your own environment. It's not tied to, it's not integrated with your electronic health records, so there's not a lot of complexity there. And once that information that I mentioned gets fed in, it surfaces recommendations that can help speed up the process of researching and resolving those denied insurance claims. Our plans were just on the finishing sort of internal security reviews of this and privacy reviews. We're going to put this out on the platform called GitHub, and you as any hospital can download it and run it in their environment for free. And all of the documentation and all the how-to will be there. We have about 10 organizations using it today, and we're in the process of rolling it out to about 100 more. And these are the types of things we want to make available to help with rural health pressing challenges. We're also creating another one around the front end of specialty referrals and making sure we take all those variables that go into making sure you've matched the patient to the right specialist and helping speed that process up for the staff that has to process and manage those referrals. So those are just a couple of examples of how we're taking a really pragmatic look and building simple tools that hopefully can help address some really pressing problems. And then finally, I'm going to end with just one thing that you can do if you're interested in AI. Microsoft has built out something they call this AI Skills Navigator. And it's a really useful tool for individuals that you can sort of answer a handful of questions about your role and what you want to do with AI, kind of where you are in understanding AI. And the tool will actually generate your own personalized curriculum, if you will, of trainings tailored to your interests and goals. And you can take those at your own leisure. And I think this is great because one, it's tailored to your own needs. Two, it's sort of self-guided, and it just gives you an opportunity to. There's so much information out there around AI right now. It kind of helps you have a starting point. All right, I have talked really quickly through a lot of content. This is a great page for you to bookmark, and you will have these. I'll send these slides out. The blue links are the registrations to the cybersecurity program, for the free assessments, for the nonprofit offers, for the training. There's a link for the webinar series I talked about. I'm going to talk about one more thing, which is the rural health community. And then also a link to our webpage. So the last slide, I have them slightly out of order here, but along with the work Microsoft has been doing, there's been sort of a groundswell of recognition across the health IT community that we can do and should do more collectively to support IT leaders in rural healthcare. So we launched a .org last year, myself and some other long-term health IT professionals, to make that happen. And it's really designed to be a networking forum for rural health IT leaders, to be a voice of advocacy, and to provide access to really low-cost, innovative programs. And I just mentioned, I talked a lot about the Microsoft one. We're super excited that we are about to launch a program with Starlink to bring their satellite units to rural healthcare, somewhere at close to 88% off of commercial prices. And this is for rural healthcare organizations. And we're going to continue to do that. We're going to continue to work with the healthcare IT community and bring in high-value offers to rural healthcare. So there's the link to sign up for the newsletter and get more information. And we're not selling this. We're not going to spam you. This is very much a grassroots nonprofit endeavor. All right, Laura, I covered a lot in a hurry. I had time for a couple of questions, if there are any.
We don't have any in the chat just yet. So if you have any questions, please feel free to either unmute your line, we're a small group, or if you want to put something in the chat. And thank you, Laura, for such a great presentation. Just to kind of give a little context, how many facilities are you aware in Oklahoma that are working with you guys?
Yeah, I'm going to have to look that up, but I can definitely do so. We have about almost 650, actually over 650 as of Friday, hospitals across the country. And that's about 30% of all rural hospitals to date. Now, some of them are part of large systems, but the majority of those are independent rural hospitals. But yeah, we've had about 650, 700, and would love to support all of those in Oklahoma. And Laura, I apologize, I don't have those numbers handy, but I'll get them to you.
No, I'm sorry to put you on the spot. But no, the nationwide number, that's great.
Yeah.
Are there any questions real quickly?
All right. Well, you have my email is on the cover page, and then you have all the links and resources you should need. So I really appreciate this opportunity. And I also want to say thank you to everybody working in rural healthcare today, because it's always been hard, and there's lots and lots of challenges in sort of the financial landscape right now.
Well, thank you so much for taking time, spending time with us today. I know that was a lot of great information. If you get off the call today, or if you are watching this recording and you have any questions at all, please do not hesitate to reach out. We do have a comment in the chat. Thank you. And then Tim is giving applause hands. So thank you again, Laura, and everyone. Have a great rest of your day.
All right. Thank you.